How did you come into social work?
Well, I came into social work, probably, or social care, I should say, quite late, and I started as a family support practitioner. And very quickly, I realised it was actually a social worker that I wanted to be. And I was quite lucky to be supported by the service manager who told me about the employment route. That was invaluable because throughout that time, I got a lot of good grounding for social work. Throughout the employment route, you're sort of working as a family support practitioner beforehand, was the role I did. And then you're working with the students on placements, and within the University of East Anglia is where I did mine. So you're getting their experience as graduate trainees within the teams, which you can build on that you got as an actual worker for Suffolk. So it's a sort of combination of two factors.
And what opportunities have Suffolk offered you since you've been qualified social worker?
When you first come in, before you get your registration, you again become a family support practitioner, but as a social worker. And then you become the ASYE once you've got your registration. And I would say to anyone, try not to run before you can walk. Use that time, because that's such a valuable time where Suffolk really do look after you, and you're being nurtured to sort of grow and develop your strengths, and being able to sort of find out what it's like to be a social worker, but at a lot more protected pace. And then I think the complex cases get given to you, and I was actually given the opportunity to become experienced social worker 2 years after becoming a social worker.
So do you have any other development and training opportunities or future aspirations?
Absolutely. Again, there's a wealth of training, and I think what everyone should be sort of mindful of is you've got to be responsible as well for your own training. CBD is really a great tool, and spend time to sort of go through there and look at what interests you. Talk to colleagues. I mean, at the moment, I'm really keen to do the ABE training, which is Achieving Best Evidence. I'm looking at becoming an on-site supervisor. A lot of my colleagues are doing the practice educators. There is just endless. You can look at doing training in mental health, domestic violence, substance misuse, and I think really look at what you feel that you're passionate about and what you can bring to the job.